Assalamu alaikum. In this video, we are going to discuss about ENT's Ospe, and this is my fourth video on the instruments for ENT Ospe, and this is the last one too. Here we will discuss about the larynx and trachea instruments. So let's start. The first instrument shown here in front of you is the laryngoscope, and this is mainly the direct laryngoscope. I will show you indirect laryngoscope as well. Here you can see that this laryngoscope contains two portions. One is its handle and the other portion is its blade, and its blade you can clearly see that it is somewhat curved blade. Okay, this is Macintosh laryngoscope, but if the blade is straight, then this is Miller's laryngoscope. How you can remember it? You can remember it by a mnemonic that Macintosh contains C, so C for curved also. So this is my Macintosh laryngoscope, but this is the straight laryngoscope. Or you can also write in your OSPE exam as direct laryngoscope as well if you don't want to indulge in such confusions. Okay, so here you can see that this is the handle, and handle contains battery, and above it there is the blade. It has a light outlet, and here is the fiber optic bundle. And as this is curved blade, so this is Macintosh laryngoscope or direct laryngoscope. Here is the picture where bronchoscopy has been shown, that a tube is passed, and as this is bronchoscope, so it has to be passed in your bronchi after passing through the trachea and main bronchus. And this is the bronchoscope. Here you can see that its distal and three holes are present. As you know that when you insert this instrument into the person's bronchi, then the whole airway is blocked. Here you can see whole airway is blocked, so you must have to put such instrument in which holes are present, so that his or her patient's uh, mm, airway can remain patent. Here you can again see that holes are present at its distal end, and in the next picture this is esophagoscope. First of all, let me tell you what are the uses of this bronchoscope. This is used for diagnostic and therapeutic purposes. Diagnostic purposes, like if you want to examine the tissues or you want to collect a specimen from this bronchus, so you can use it. And number two is that if you want to determine that either tumor can be resected surgically or not, or in order to diagnose any bleeding sites as well, like you want to see that what is the source of the hemoptysis means that blood is coming in the patient's sputum, so you want to know the source of the hemoptysis, so you perform the bronchoscopy. And the other purpose is therapeutic, like you want to remove foreign bodies from tracheobronchial tree, or you want to remove any mucus plug or secretions that is present in the airway, so you do bronchoscopy. Or you can also use it for the treatment of post-operative atelectasis. So next come towards the esophagoscope. Some students ask me that I should put some slides where uses of these instruments are given. Actually, I am not putting here slides, because the uses that are written in your Shruti Dhingra are more than enough. Okay, I am just mentioning here so that you can also opt for one or two uses that I have mentioned, and there is no need that you remember all the uses that I have mentioned here. Only two or three are more than enough for your OSPE. Then comes the esophagoscope. Difference between the bronchoscope and esophagoscope is that at the distal end of the esophagoscope, there are no holes, as you have to insert this instrument into the esophagus of the patient, so the patient's airway is patent, so there is no need to create holes at its distal end. This is the camera from where the doctor or observer sees. This is again the esophagoscope. And what are the uses of the esophagoscope? Again, it has somewhat diagnostic and therapeutic purposes. Diagnostic purposes, like a tumor in the upper one third and middle third of the esophagus, you want to diagnose it, you use esophagoscope. Or you want to know the causes of the GIT bleeding, or in the diagnosis of the GERD, hiatal hernia and chest pain, etc. In order to diagnose all these, you do esophagoscopy. It has some therapeutic purposes as well, like foreign body removal, strictures, dilatations, etc. This is indirect laryngoscopy mirror, or ideal mirror. Here you can see that there is a mirror and it has a handle, but its handle is straight. But in the case of the instrument which is used for posterior rhinoscopy, that has a mirror and then handle, but there is a curve or zigzag in that handle. Here tracheostomy is shown. Here you can see that a hole is created in the trachea, and then through that hole tracheostomy tube is inserted. This tube is inserted. This tube is inserted so that the ventilation of the person can be maintained. Mainly we do tracheostomy either as an emergency procedure or either as a planned procedure after taking the consent of the patient. Here you can see that this is the tracheostomy tube. Here another Macintosh and Maller's laryngoscope or direct laryngoscope, as this is direct laryngoscope. And which structures are visible in this direct laryngoscope? Here all these structures are mentioned. You can take screenshot. And then here you can see that this is cuffed tracheostomy tube, as it has a cuff. Okay, as it has a cuff, so it is known as cuffed tracheostomy tube. It is the Fuller's or bivalved metallic tube. You can see that it is the outer tube and this is the inner tube. You have to insert this inner tube into this outer tube. Okay, and it is known as bivalved because here it is somewhat slit like opening is present here, or two, it has two valves, so it is known as bivalved or Fuller's metallic tube. Remember that its inner tube also has a slit like opening in it. You put this inner tube into this outer tube and then you fix it, and then it is inserted into the trachea. Let us have some review from Shruti Dhingra. Okay, so you can see from here that this is the cuff tracheostomy tube, as it has a cuff here, and this is the Fuller's tracheostomy tube. It has two portions, outer tube and the other one is inner tube. You put that inner tube into that outer tube, and outer tube is mainly bivalved. It is not shown here, but I have shown you in the previous pictures. Inner tube has a slit like opening in it, and then we put inner tube into the outer tube and we fix it. This is actually the Jackson's tracheostomy tube. It has two parts, outer tube, inner tube, and obturator. But this outer tube is not bivalved and there is no slit opening in this inner tube. We put this obturator first into this outer tube and then we place it into the patient's trachea. After placing it into the patient's trachea, we take this obturator out and then we put this inner tube into the outer tube. Okay, so you can, as all of these are used in the tracheostomy, you know that what is the tracheostomy, creating an opening or hole in the trachea. This is another cuffed suction tracheostomy tube. Here is the laryngeal mask airway. Clearly see that this is the laryngeal mask airway. Okay, it has a tube, okay, and it has a laryngeal mask as well. And then comes the bronchoscope. Here you can see that if you zoom it out, you can see that holes are present in all of these instruments. And then comes the again the bronchoscope, holes are present here. And then esophagoscope, and then comes the laryngoscope. As it is curved, so it is Macintosh. As it is straight, so it is Milers. But you cannot say that Macintosh is used in children and Milers is used in adults. It can be anyone depending upon the size of the laryngoscope. Tracheal dilator, I have discussed it in my first video with all the forceps. You can watch from there. One instrument remained is tracheal hook. It can either be blunt or sharp. This one is blunt. Okay, so here you can see that this is the blunt one, but this is the sharp one. Okay, see its tip very carefully. This is blunt tracheal hook, and this is the sharp tracheal hook. Okay, it has a handle and simply a hook-like tip, just a hook-like tip. And this blunt tracheal hook is mainly used for, like, this is your thyroid and in center is its isthmus, so it is used to retract the isthmus either upward or downward. And this sharp tracheal hook is used to is mainly used, or it is mainly applied to the lower border of the cricoid cartilage, so that you can easily stabilize the trachea and prevents its movements during respiration. So that was all about larynx and trachea instruments. But one instrument I have not mentioned here is endotracheal tube. Please see its picture from the Google as well. I have not that picture taken, otherwise I will must have shown that picture to you. Thank you very much.